rate dropped to less than 1%. Some pretty startling statistics. Today you might think we have come a long way, but in 1992 in the New England Journal of Medicine, there was a study on hand washing in an intensive care unit, and they found that the hand washing rates were as low as 3% and never rose higher than 48%. So less than half of the time people were not washing their hands. In 1993, there were 11 healthcare workers who became ill with hepatitis A because they didn't wash their hands after treating one of 2 patients that had it. Norovirus. Noroviruses are a group of viruses that can cause gastroenteritis, which is an inflammation of your digestive tract, your stomach, your large intestine, and your small intestine. Some of the symptoms of norovirus, which of course is transmitted by hands, is nausea, vomiting, diarrhea, you have stomach cramps, and you can have a low-grade fever. Chills can also be part of the mix, a headache, muscle aches, and generally feeling very tired. How long does it last? Usually 24 to 48 hours after you ingest it. It can be found in stool or vomit of infected people for as long as 2 weeks after the symptoms are gone. So even if you feel better, you can still be passing it along if you're working in a food establishment and you're not washing your hands and you're not wearing gloves for ready-to-eat foods. The virus is spread by eating food or drinking liquids contaminated with it. Tiny droplets from nearby body can travel through the air to land on your food. Touching contaminated surface or objects and then placing your hands in or near your mouth, you kind of do this. Having direct contact with another person who is infected and showing symptoms. For example, sharing foods or utensils. It's very contagious. A very low dose can make you ill. Fomites. Does anybody know what a fomite is? It's a fancy word for basically an object, like a fork or a knife. It's something that's a hard object. A table. Viruses can survive on hard surfaces, fomites, for days or weeks. Examples again would be door handles, light switches, refrigerator door handles, which is why it's really important to keep all of the surfaces in your kitchen clean. Whenever I come and do an inspection, I always look at the door handles on the refrigerators. Usually you don't notice it, but food cakes up inside the door handle and it doesn't get washed. One of those things that should be cleaned routinely. Cell phones, a study was done on cell phones and it was found that there was a lot of bacteria on cell phones, elevator buttons, handrails, and linens. What should you do with linens? What should you do with your aprons?
Pick it up, put it to wash.
They should be washed right away. You shouldn't wear them for 5 days. 6 days? Okay. Okay, so again, the surfaces can lead to transmission of the virus through direct contact by touching the surface, by touching the table, by touching the refrigerator door. What is the significance? It's estimated that noroviruses cause about 23 million cases of severe gastroenteritis a year. The CDC actually did a study on cruise ships after there was a problem with Carnival lines. They had went through 18 cruise ships, and out of 18, 12 ships were found to have norovirus. By law, cruise ships that enter a U.S. port from a foreign one are required to report to the CDC 24 hours prior to the time that they come in. The total number of passengers or crew that go to the doctor that seek medical care on board for gastroenteritis. Again, this is what I was touching on before. This was between January and December 2002. The CDC investigated 18 cruise ships, and 12 were confirmed to be to have norovirus. Closer to home, in 2008 in Bordentown, 75 of 573 students in kindergarten to 3rd grade called in sick. And the reason why was norovirus. So, What does this mean for you? Keeping hands clean is one of the most important things you can do to avoid getting sick. Swine flu, wash your hands. A 2002-2003 study of foodborne illness outbreaks in restaurants found that food handling by an infected employee was a contributing factor in 2/3 or 65% of outbreaks. It's a really high number. Wash your hands. How do you wash your hands? You wet your hands with warm running water. Why do we always check the temperature of the water? Water has to be 100 degrees Fahrenheit. You're supposed to apply liquid soap, lather up well, and you want to lather up, you want to clean it between your fingers, you want to go underneath your fingernails, you want to do the backs of your hands. Rub your hands together for at least 15 to 20 seconds. Again, sing happy birthday twice. Do this when your hands are away from the water. Rinse well and dry with a clean towel, and then shut off the water with the towel. Basically, wet hands, soap, wash for 20 seconds, rinse, dry, and use the paper towel to shut off the water. And to sum it all up, if you wash your hands, you'll stay a lot more healthy, and you'll keep other people healthy as well. Okay.
Thank you.